Headache is that sensation of pain and discomfort perceived in the head area and in the upper cervical portion. In medical parlance, headache is also known as CEPHALEA. Let's see better what it's about in today's video. Hello and welcome to Med4 Care. Today's topic is headache. It is a very common symptom within the population and affects men and women of all ages equally, making it the most frequent disorder of the nervous system. Around 95% of the population even declared that they had experienced the symptoms of a headache at least once in their lives. Precisely to represent the great impact that headaches have on the population, the World Health Organization has included this symptom among the top 10 causes of disability in the world, and, in women, headaches appear to have a disabling significance similar to that of arthritis or diabetes. Most types of headache do not require intensive treatment, but it is important to recognize those forms of headache that can evolve into more serious clinical situations. To begin with, it is reasonable to ask ourselves where the headache originates from. Well, in most cases there is a combination of endogenous causes, genetic predisposition to headaches, and factors that can trigger the crisis. Jokes apart, in various situations, headaches can be the direct consequence of mechanical trauma in the cephalic or upper cervical region, such as in a car accident. In other cases, however, when the meninges become inflamed, as in meningococcal infections, the excruciating headache is the direct product of the infection. Even a prolonged state of contracture and compression of the muscles surrounding the neck can be responsible for the production of pain signals, which are felt especially in the nuptial area. In any case, regardless of the cause, headaches are always caused by the activation of specific pain receptors. These pain receptors are widespread in the cephalocervical region, as well as in blood vessels, periosteum and muscles. We should also remember that some factors related to lifestyle, such as smoking, alcohol and altered sleep-wake rhythms, can certainly also trigger temporary headaches. Going deeper into our topic, it is also appropriate to classify headaches into two large categories: primary headaches and secondary headaches. Primary headache is considered the most frequent form of headache and does not always recognize specific underlying causes, while secondary headache is the consequence of a particular pathology. They are part of the primary ones: tension-type headache, which is the most common type of headache and appears as a tight and compressing pain in the head. We certainly have migraines, the second most common form of headache, and described as a throbbing pain in the head, accompanied by nausea, vomiting and episodes of aura. Finally, we mention cluster headaches. This is an uncommon subtype of primary headache that mostly affects young men through painful attacks that last up to 3 hours. They cause the patient to sweat profusely, to be restless and to tear. Secondary headaches are rarer than primary headaches, and it is very important to recognize them in a timely manner to avoid serious complications that can lead, imagine, to the rapid death of the patient. Secondary headache is a symptom of another pathology, and when it is associated with fever and an alteration in the state of consciousness, it is mandatory to investigate the possible presence of an infection affecting the central nervous system, such as meningitis or encephalitis. In women who take oral contraceptive pills and smoke, headaches can be caused by cerebral venous thrombosis, especially when experiencing particular symptoms such as morning headaches, nausea and small seizures. In all cases of secondary headaches, it is therefore always important to investigate the intrinsic characteristics of the headache by evaluating its duration and mode of onset. The symptoms most often associated with this type of headache are nausea and vomit, photophobia, visual aura or auditory aura, sensitivity to sounds and noises, tearing, nasal congestion. A pertinent question is, to whom and when to refer in the presence of these symptoms? An interesting treatment model may provide that the headache is first evaluated by general practitioners who are able to recognize the potentially more serious forms. After that, a neurological examination is necessary. The visit begins with a detailed medical history which initially focuses on the presence of any diseases from which the patient suffers, on family history of gene-transmitted diseases, and on the list of drugs currently taken in case of therapy. The doctor then proceeds to objectively examine the patient, first inspecting the entire region of the head and neck, and then evaluating the state of the anterior chamber of the eye, the balance and functionality of the brain nerves. If deemed necessary, the doctor may resort to carrying out certain maneuvers if he suspects a case of meningitis. In addition to blood tests, which are routinely requested, to characterize a headache that arises suddenly and excruciatingly, it may be necessary to carry out a MRI of the brain to look for possible thrombosis, heart attacks or tumors. Let's now look together at the cures and treatments for headaches of various types. Migraines are often treated with nonsteroidal anti-inflammatory drugs. Tension-type headache can benefit from the administration of painkillers, but physiotherapy often also appears to be an important treatment for alleviating muscular and skeletal symptoms. Cluster headache is the most difficult form of primary headache to recognize and requires more intense and specific treatments, often based on corticosteroids and serotonin receptor antagonists. In conclusion, headache, or CEPHALEA, is one of the most commonly reported symptoms within the general population, often appearing in the form of migraine or tension-type headache. The initial treatment is most often initiated by general practitioners and involves the administration of non-steroidal painkillers. In more serious cases, a neurological specialist consultation is mandatory. We remember the importance of recognizing in time the symptoms that are a prelude to a secondary headache, which, if not recognized, can often evolve into very serious complications. We have now reached the end of today's video. We hope you liked it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video of ours comes out. See you soon on Med4Care.